Great, awesome. Thank you. Good morning, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and thanks for joining us today. Here comes Taylor. Thanks for joining us today for Why Kids Need Things to Do. Today is National Lights On Afterschool Day. It's a national event sponsored by the After School Alliance, held each October to shine a light on after-school programs and the opportunity they provide for young people to learn and grow. The next hour will be an informal but hopefully robust chat about after-school programming, mentoring, community engagement, all those things that make this type of programming enriching and positive for all kids, but especially those who are affected by the drug crisis. Think Kids has been working on a 2-year project now sponsored by the Greater Kanawha Valley Community Foundation to articulate and elevate the unmet needs of children affected by the drug crisis. And those of you who are participating and sharing your ideas with us on this project, you know that the idea of kids needing stuff to do, particularly in our more rural communities, is one of the top 5 priorities to responding to that unmet need. If you're interested in learning more, visit our website at thinkkidswv.org, and you can hop on over to our Facebook group dedicated to this project. We would love for you to join. And so let's begin the conversation by quickly introducing our panelists. Joining us today are Susan Gamble with the West Virginia Statewide After School Network, Dr. Todd Davies with Marshall Health, as well as Taylor Maddox. India, I'm so sorry. How do you pronounce your last name again?
It's Krawczk.
Krawczk, so simple and yet so confusing for me, and I apologize. With Active Southern West Virginia, and Amy Connelly and Evan Young with the Putnam Wellness Coalition. Thank you all for joining us today. And finally, I'd like to introduce Maddie Lavoie, our social media volunteer and a familiar voice to those of you who join us for these Facebook Lives. She's with us today from the West Coast, so thank you again, Maddie, for getting up so early with us. And she'll be keeping an eye on our comments section. And so if you have comments or questions, type them below, and we'll turn to Maddie a few times during the conversation to see if you have anything to add to the discussion. And so let me stop sharing my screen and ask the first question. Part of Think Kids project with the Greater Kanawha Valley Foundation is studying the unmet needs of kids affected by the drug crisis. A prevailing theme we found was both simple and challenging to achieve. Kids need free and accessible things to do in their communities. Why do adolescents, children, and teens need things to do, meaning within their community? Is this just common sense, or is there research behind this assertion?
Sure, Kelly. I guess I can kick us off. What we know is that the research does show us that kids in 1st through 12th grade spend about 80% of their waking hours in out of school time. So that is a whole lot of space to be thinking about how we can better serve kids before school, after school, and weekends. Also, just a couple of years ago, there was a report that came out from the Council for Strong America from Risk to Opportunity about after school programs, sharing that our greatest times for children to be at risk is from 2 to 6 p.m., which is really those times whenever often parents are still at work. And that's the time when kids are most likely to engage in risky behaviors. And it also could be a time when crimes are more likely to happen against children as well, when they might be unsupervised and alone.
Great point. Thank you, Susan. Anyone else want to jump in on this question?
I will just add to that. Thank you, Susan, for that info. Again, my name's Evan. I'm with the Putnam Wellness Coalition. And when we look at our logic model and we review the data from surveys, Pride survey data from youth in schools, we typically find that they first use substances in that time after school, as Susan mentioned. We also know where is it? It's at home and when parents are not present. So after school and on the weekends. And then we also look at favorable attitudes. They have favorable attitudes towards underage drinking and using other substances because it's a social norm. And some kids just have the attitude that there's not really anything else to do around here. So I will supplement, substances into that void and fill the gap.
That's a really important point. Thank you, Evan, for bringing that up.
I can follow on that a little bit. When we look at, again,
I'm Todd Davies from Marshall University's Division of Addiction Science, and so, my research is into all aspects of addiction, but we look primarily at neonatal abstinence syndrome and adverse childhood experiences. And when you look at this longitudinally, so as you follow kids out, and you look at people who have really suffered from long-term substance use disorder, right? Their age at first use is usually somewhere between 11 and 13 years old. So that's fairly young. Oftentimes we see a fairly significant trauma history. And so, we talk about these childhood traumas and what that means very functionally in terms of, how it is affected by after school events is you have a skills deficit, right? So you have kids who have these kind of traumas, particularly you see this in low social economic areas, where they don't have the skills. They don't react well to healthy relationships. They have trouble developing their own healthy relationships. And when you look at the way the neurobiology works, those healthy relationships help build that, that functional dopamine system that allows for a very positive, very healthy, reward system. And so that's where we get the expression, the idle hands or the devil's workshop. And so if they don't have the skills to develop healthy relationships, if they have trouble relating to other people, are lonely a lot. If we've polled, we've done surveys and thousands of people with adults with substance use disorder, and you say, okay, what got you started? The top answer, almost 60% of the respondents will say, I was bored. So most of the respondents will say, I was bored at 11 to 13 years old. So just in that tells us this is really a key demographic for us to engage in maintaining activities that are healthier, that help build these life skills, help build these relational skills, in order to address and the prevention of long-term substance use.
Yeah, and I think what you just said, Todd, about that 11 to 13 years old, whenever people think about after school, they're often thinking about the younger grades, but we're really talking about, school age youth from kindergarten all the way through graduation.
These are all really important points. Go ahead, India.
Yeah, I also wanted to note that the idea that kids need after-school activities as a drug prevention measure is kind of backed up by the Icelandic study. For those who aren't familiar, just a quick overview is that in Iceland a few years ago, they were able to do almost eradicate their youth drug issue by just providing activities. This is a simplified version, but provide activities for kids to do. And so we're replicating that model in Fayette County a little bit through surveys and providing activities. But again, it just breaks down to the idea that if kids have things to do after school, if you engage with families and caregivers as well at home, then you can reduce the number of kids who fall into the drug abuse category.
Thanks, India. Todd, do you want to?
Yeah, that's a great point, and the Icelandic model is a wonderful example, and a great lesson we could take from the Icelandic model, because they had a very severe alcohol problem. So they had a lot of high school kids who were getting out and getting drunk and getting into trouble, and so they changed the entire school system, but they didn't change it overnight. It took them 20 years to convert from a system where they had very severe alcohol and addiction issues and translated that all the way through. So they started at the lower grades and then slowly changed everything as they work up. I think sometimes we make the mistake of we have to go in and we have to change everything all at once. But if we have a long-term plan and a systematic approach, we're going to get a lot farther, a lot faster, I think.
A great point. And I forget the adage, if there's something that you should have done yesterday, you should start it now. I grew up in very rural West Virginia, and in the 80s, there was nothing to do. And that is why, people started drinking and going out back roads and building bonfires. And that's what we did back then. And when I started this project and we went to the 6-county area, just talking to people, it was so surprising to me that there were people still doing the same thing, except now they're engaging in much harder drugs that weren't available to us, back then. And so, if we really want to change the trajectory of these kids' lives, we have to invest in something that will take 20 years. There will be no quick fix. So thanks for all of that. And let me segue to the next question. Hand in hand with quality programming, we need caring adults to facilitate the programming. Why are caring adults, volunteers serving as mentors in the community, so important to all kids, but especially a demographic of children who may have experienced adverse childhood experiences?
All right. Well, I guess I'll jump in first. Here so I'm in Marshall, so I'm in Campbell County. We have a Big Brothers Big Sisters program that provides mentors. It's a wonderful program. They provide training, they provide education. Mentors have to spend, maybe 4 hours a month mentoring, and they have a lot of great data that shows that it improves because we know that mentors. We expect kids to learn these skills, but then who's going to teach it to them? The teachers, their job is to teach academic, all the academic stuff. If you go to coaches, there's a little bit of, a lot of coaches will teach some of these life skills, but again, at the same time, they're teaching other things. Having an adult, somebody who's, healthy and willing to support them will change the entire way their neurobiology works for these kids. And it really will help them develop, give them an example of, okay, this is a person that just comes here to spend time with me and talks about whatever we want to talk about. And we do simple things. And that's how the kids, that's how they learn. That's how we all learn. And when we look at the Big Brother, so we have a great program here. We have lots of kids that are available, but they have a waiting list of 80 to 100 kids at any one time because there aren't enough adults willing to spend their time. 4 hours a month is what we're talking about. There's not enough adults willing to spend that time and say, hey, I'll give some time to help some kid and, and just be there to be somebody to talk to and be supportive and be a neutral party. That's not the school and it's not CPS and it's not their parents who, may be doing whatever, just somebody who's there just for the kid. And it makes a world of difference. There's great data showing that it makes a world of difference. And, but people need to step up.
I'd like to jump in on this because I'm really passionate about just the topic of adverse childhood experiences and how we can help these young people overcome and heal from these traumas. But again, if you're not really familiar with the ACEs, the adverse childhood experiences, a lot of these young people have endured traumas in their home. It could be due to parental neglect, even verbal and physical abuse, or a parent may not be present, maybe they're incarcerated. And all of these things add on layers and layers of trauma, which Dr. Davies has mentioned, hits our neurobiology, and just their emotional aspect and all of the above. So when we mention an adult being a key equation in the success of a young person and them building skills and resiliencies, it could be that they've never had a consistent adult figure in their life to support them or to just be there, present, aware, present and in the moment with them. A parent that's not distracted. And as we look at this, as technology continues to consume everything in our lives, just regular normal parents like you and I, we may be more distracted than we realize. And we may be pulled away from being present in the moment with our young people when we're sitting in the same room with them. So I just wanted to put that out there as well, just that we're mindful of that slight detail and that it could creep up on us as well. I'm an outdoorsman myself, I'm a waterman, but I still need to be intentional about my screen time and things like that. So not to add another thing or open another can of worms, but I just wanted to acknowledge that as well, that these young people just need someone not that it's over the top or too dynamic, but just consistent. And we all know that people that deal with anxiety need predictability in their lives, and then it helps ease their anxiety and it helps them thrive and flourish.
Yeah, and to follow up on that, after school just had, and our summer learning programs too, just have a really great opportunity to foster protective factors for youth. Kelly, I think on some of those slides I sent you, there's one in there about the third or fourth one in on protective factors. And, I love that we talked about boys, big brothers, big sisters earlier. And, I really should have prefaced to someone whenever we're talking about different programs that, we have a variety of programs going on in our state, from, 21st century programs that are school-based and community-based, childcare centers serving school-age youth, YMCAs, Boys and Girls Clubs. And, I know that we'll probably talk a lot more today as we kind of go through, but that these programs are really working to support and foster protective factors. By there on this slide, you see about how it helps youth and those caring adults and volunteers that we were talking about at the individual, family, and community level.
Pop that back down, and please know that we'll make all of this information available to folks after the discussion. And so, so what we heard again with the project overwhelmingly, almost every virtual listening session that we had, was that there's nothing for the kids in the community. So, even, and I don't mean just in the county, but at the community, because it becomes challenging for families who don't have the means to go from one end of the county to the other to access care. And so we know that there are some great programs out there doing really good things. It's hard to find them, which, we don't have a centralized list of all of them in a community. It's hard to find out if there is a waiting list, if it costs, but these are just some of the challenges. So what are some of the other challenges to providing this important after school and community programming, that is impeding us from providing more services to more kids across the state?
So I work with Active Southern West Virginia, and one of the things we do is after school kids run club programs. So we work with schools to get kids active and volunteer-led after-school kids run club programs. But we obviously face some challenges with engaging kids, engaging the schools, whatnot. Some of the main challenges, I think, to getting community and school-based programs going are transportation. A lot of times either kids don't have a way to get home after the program or get to the program, depending on the location. Another challenge is finding volunteers willing to help out, or if you're going to pay your volunteers, then finding a funding source for that. Getting the word out about programs, like you said, there's not a centralized location where everything is listed, so that can be challenging. And locations to hold programs also, whether it's working with the school is great, but sometimes that doesn't always work out. So lots of challenges there that get in the way of that. And also people don't seem to be as willing to fund preventative programs as maybe kind of cleaning up the mess afterwards. So framing, after school activities as like a preventative measure against drug abuse is sometimes a hard sell at times to get funding for that. So just some challenges there to consider.
A great list, India. Thank you for that. Yeah, I just want to say that when we started these discussions last year, we were talking about the importance of cross-pollination. For example, a pediatrician who may notice that a child could really benefit for after school. How is there a warm handoff there? How's there a warm handoff, as you said, from that school to this programming? Because if we don't find those connections and a way to easily refer a child from point A to point B, we fall back on the way we used to do it, which is sending home information to parents. And if part of the problem is inattentive parents, then that information, the child's not going to get enrolled. And so it really has to take a community effort, kind of more of a, cross-system effort to ensure that kids who need the programming are aware of it and get some help in getting enrolled.
Kelly, that's a great point and something we're working on with Putnam Wellness. We love the model that Active Southern West Virginia has. You know, we look at what they're doing in Fayette County, and you know, it's the outdoor recreation capital of West Virginia. People are healthy, thriving, and enjoying the outdoors there. We try to replicate that back into the suburban areas, you know, around Putnam County. But one topic we've been challenged with is, you know, we'll try to hold an event, but maybe we don't have a great turnout, or maybe, you know, COVID had something to do with that, or people's busy schedules. But one thing we've been envisioning is just taking the resources to the people where they're at, where they're in need, and in their neighborhoods. So this is just something we drew up recently. This is just a hand-drawn map of Putnam County, you know, got my county. But what we've done, we've got the river and the highway, but we've identified hotspots throughout the county. And that was just, you know, something we did as a group at a training camp together. But the hotspots would be places where youth use after school, or maybe where there's socioeconomic challenges and other adversities. So we've identified places in Putnam County. It could be a specific trailer park in town, or government subsidized housing location where we can go reach those families. So some things we're working on are called after school pop-ups. We have some portable disc golf baskets we purchased with Putnam Wellness Coalition. It's super fun, and it's really rewarding if you can throw a disc in the basket. And we've assembled some of those resources so that we can take those with us when we go do outreach in communities, so that we can engage the kids and families in a fun new activity together, and just meet them where they're at. So that's just one thing that we're working on. We haven't figured that out completely yet, but we're working on it, popping up at local parks and in communities where we can do that for free and get it close to the people that need it.
That is
If
wonderful.
I could, oh, I'm sorry.
Go ahead.
If I could add to that a little bit, another one involving reaching out to the community where the need is involves the Putnam Quick Response Team. So the Putnam Quick Response Team goes to high-risk neighborhoods and goes out to visit individuals who are at risk from substance use disorder, individuals who have overdosed within our county. And what some of the volunteers with the QRT are finding is that the kids are drawn to them, that there might be young kids that come with the people who are seeking help, and that having things on board, activities to do with the kids to kind of preoccupy them and reach out to them, is beneficial. So one of the partners in our county, Great Rivers, kind of sent the call out, and actually a local high school student at Poca High, Miss Jessa, actually got together some packets of information and activities and things specifically for the kids. So what we're trying to do as a community is to try to reach the kids as we're reaching the adults in those areas.
That is amazing. That is really amazing. And I see that Todd has unmuted, and I'm glad, because I know that this is, you know, trying to reach out and coordinate and get some of these folks on board to your project, Todd, has been a bit of a challenge as well.
Well, it has been, but you know, all of the answers actually brings up a question for me, and Amy, your story really highlights this. How much time and effort? Now, I'm in a lab. I look at data. I'm a researcher. I talk to the patients we have available to us. But in your programs, how much time is spent encouraging some of the younger people to engage and design some of these programs and sort of lead the charge? And how does that affect, when that happens, how does that affect the program?
I think that's a good question for Evan. He's the one that's kind of working on our youth leadership board.
Well, yeah, with Putnam Wellness Coalition, we also have a branch of, we engage 12 key sectors in prevention. So it could be everyone from youth serving organizations to law enforcement, but also faith groups, students, parents, but the youth primarily. We have a youth advisory council where we seek their feedback about what they're seeing, hearing, and feeling in their schools and in their spheres of influence. And you know, we lead by listening. You know, what are youth really? What kind of challenges are they really facing in their lives? We look to equip and empower them to contribute to the ideas, to the vision. We want it to be for youth, led by youth. So that's just one of the key things. We strive to set consistent meetings with the Youth Advisory Council. And I don't want to jump topic, but there's something that India mentioned towards the end of hers, and I don't want us to miss this real quick. And the statistics or the facts may have changed, but I do know she mentioned there's not as much money invested in prevention as there is treating people that have fallen into substance use disorder. And last time I learned, for every $1 invested in prevention, there's $29 invested in intervention and interdiction. So that's arresting folks and then helping treat people and helping them recover. But out of every $30, only $1 is spent on prevention. And that was the last information I heard. So it's really lopsided here. You know, we could invest a lot more on the front side to help us with issues we face down the road that stem from substance use disorder. So I'm not sure if I answered the question, but I did want to lift that up, that India had mentioned that. And I'm not sure if everyone understands the broad scope of how important that is and how important the whole continuum of care is as we serve young people and people with SUD.
That's such an excellent point. I'm glad you lifted it up, because in my experience in talking with legislators or policymakers, when we talk about prevention, their mind kind of immediately goes towards, kind of that intervention of just say no, or how do we keep them from initiating drug use, rather than an investment in communities to ensure that kids have these programmings ahead of time. And I feel as if Think Kids and other advocates around the state need to get better at really articulating what we mean by prevention, because what we're talking about now is essentially prevention. And I think we need to do better education and better marketing of that.
Well, and I think it's a more systemic problem in the way that we look at issues altogether, right? One, I'd be excited if it was as good as the 1 to 29. I don't think it is. I think way more money goes into prevention, or way more money goes into treatment and recovery and those kind of things than prevention. It's probably more like 100 to 1 if it's that good. When we look at things, and it's part of the way we measure success, right? And so when you look at I can say, okay, well, I put money in and I treated X number of people, and I was able to get so many people into recovery, and I was able to get so many people jobs, and I can measure those things, right? It's a lot harder to measure things that didn't happen, right? And so so we want to prevent something. So if we prevented 100 kids from trying substances, or we prevented traumatic events from occurring, what are we saying there? We saw something not happen, right? And so when you look at policymakers and you look at funders, it's very hard for them to conceptualize. So one of the things that we're trying to do is create better measurements for prevention. So we want to look at outcomes that are a little bit more functional outcomes. When we look at, so I can tell you here in our area of the state, we have a serious problem, and this data is going to come out soon. I can't talk about it a whole lot now, but the level of ACEs and the number of kids who have that are high risk for significant traumas is much higher than anybody thinks it is. And so we're going to try to attack those areas, because we know there are some areas that are high risk that we can lower, that we can measure the change. But really, I think as a community that is interested in kids, that is interested in making sure we're raising healthier adults, we have to really have a very open and honest conversation about how we measure that and what we see as success in prevention. And I think if we can identify those kind of functional measures, those kind of things that say, okay, this is a real tangible thing that we can measure, we're going to get a lot more success in raising prevention dollars.
Anyone else want to tackle this before we move to Maddie and comments online?
I just love all of these comments. And I also want to say, I think one of the overarching themes there is collaboration. We've talked about families and communities and schools, but I mean, having high quality opportunities for our youth is such a significant workforce issue for our state. I don't want to go off too far into, excuse me, of a tangent, but, having, first of all, right now, our workforce with children having a place that where kids can go and have access to, there's been a lot of discussion around our state about having enough workers in West Virginia and, women in the workforce, and that's only being able to be provided if kids have places to be, but also that our kids participating in these programs, they go to school and learn about what they love at school, what they maybe want to do in their future. And then these other programs are those times to go and practice and engage in those, whether it's STEM or arts or physical activity or whatever that may be. I mean, we're really investing in our future workforce when we're investing in these programs.
Susan, that is a fantastic comment. When we look at workforce data and you see, okay, so we have a lot of people in companies will train people. Where we're really lacking in terms of our workforces is we're lacking, companies will train anybody if they show up on time and if they, have the right social skills and if they have, and if they're not having, memory lapses, if they don't have impulsivity issues. So a lot of these, soft skills, as we say, because of the level of trauma in the state, because of the lack of, healthy interaction that a lot of these kids are seeing, particularly in the poor socioeconomic areas, that is a huge barrier for a lot of these kids to get into the workforce, even though they're brilliant kids and they're smart enough and they're strong enough and they're willing to work. These soft skills that aren't being taught, that are often learned and can very much be taught in after school programs, just by teaching them how to interact with people, teaching them all of those critical executive functioning skills. I think it's a huge barrier beyond just, getting them interested in a particular workforce, but actually teaching them soft skills that they're not getting at home, or that they may have genuine cognitive functioning issues because of trauma issues or because of, exposure to substances or whatever.
On point. Thank you, Todd. Okay, we're going to turn to you, Maddie. Maddie, are there any questions or comments you want to share from Facebook?
No questions so far, Kelly.
Awesome. Thank you, Maddie. Let's go to, this is probably going to be for Susan. Let's look at some statistics. So how does West Virginia rank in providing after school programming? Are we ahead of the curve or are we lagging?
So whenever we look at our data around after school programs for youth, we look at the America After 3 report from the After School Alliance, who is a national group focused around after school, who is also helps host our national Lights On Afterschool event today that we're celebrating. And so about every 5 or 6 years, data comes out from the After School Alliance around where what's happening in after school across our country and where schools are at, or where where states are at. So I really don't have data to say like, well, we're this number out of 50, that sort of thing. But we do have some good data around after school in West Virginia. The last America After 3 p.m. report came out in December of 2020, which they, that was, of course, they had gathered all the data and planned for the data to be released in October. But then, COVID hit. And so they made a few adjustments. But with that data that last came out, we know that for every child in West Virginia that participates in a program, 4 more are waiting for an available program. So we have about 12% of children in West Virginia participating, and 46% would like to be enrolled. And that data is done through survey data, I should say, through surveys and interviews with families. So we did see some decreases last time in the number of programs or amount of kids being served. But we know that we had some really good information that was provided around parents being satisfied with programs, the different types of activities that youth were being able to be engaged in around after school, but that we still have a long ways to go with our offerings here in our state.
Susan, that doesn't surprise me, but it is rather depressing, right? So we need more of a coordinated response to ensure that services are accessible. Has there ever been, out of curiosity, kind of an assessment of like where services are? For example, are there programs that have wait lists around the state?
So programs, we do know that there are programs that have wait lists. So quite a few years back, the After School Network did do a mapping of programs, where they were at, who they were serving. We recently did finish up through the Greater Canal Valley Foundation, a new mapping of their 6-county region, but that's something that we're looking at tackling. It's difficult to navigate in terms of so many programs that come on board and so many programs that leave. And especially we noticed during COVID with whenever we were doing the mapping for the Greater Canal Valley Foundation, some of the closing around childcare centers that we had lost a few with the COVID impact, with having difficulties to be able to maintain. So that's something that's definitely on our radar. We do have kind of a good feel of what is happening where, but to be able to say this is exactly, it can be a bit to keep up with. It's definitely an ongoing project.
Thanks. India, I'm kind of looking at you, but then also Amy and Evan to talk about our physical health, because we know West Virginia is often at the bottom of the good lists and at the top of the bad when it comes to our health. Our kids are no exception to that. And especially with COVID, I know I gained a few pounds, and from what I've read of national data, kids have as well. So how do we use community programming to improve the health of West Virginia's kids? What are your thoughts on that?
Well, what we do with our Kids Run Club programs is, like I said, they're volunteer-led initiatives that take place after school on campus. And the idea is to get kids outside, active, introduced to physical activity, because we typically do it with an elementary age group. So at that age, they're kind of too young to have identified themselves as like athletic or not. So they're more likely to just run around, have fun, enjoy exercise, and not call it exercise, so to speak. So the idea is just to get them active, educate them about important kind of activity skills, like how to run, how to stretch your body, how to warm up, how to do different exercises like push-ups. And then the hope is also that they'll take that information home to their families and kind of share that with their families by getting active on days they don't have run club. So we do pre and post surveys with our Kids Run Clubs. They're designed by the WVU School of Public Health. And we ask questions about, physical activity level before and after, screen time, confidence in physical activity, things like that. And what we do find is that typically COVID has messed up our survey data a little bit because we haven't had as many clubs, but to survey. But in 2019, for example, I'm forgetting the exact statistics, but essentially from the beginning of the program to the end, it showed that kids did get more active. Their screen time reduced. And I believe it was 70% of kids said they were able to get somebody at home active as well. So we do encourage getting a running buddy or getting an adult at home, whether it's a neighbor, parent, grandparent, to go, take a run with you, go on a hike, bike ride, whatever it is. So again, 70% of participants surveyed said that they were able to get somebody at home active. So in those ways, we try to educate kids about how to be active so that they have those base skills kind of as they get older. They're more inclined to try out new sports as they get older. And also, like I said, kind of spread that information to folks at home to get them active as well.
Great, thanks, India. One of the things that we heard so often last year was, our kids are interested in physical activity, not necessarily sports or the sports that's offered in their schools. And for a couple of reasons, but one of them being that it can be really expensive. You know, I didn't realize just how expensive it could be to participate in middle and high school sport activities. It's really kind of crazy, especially if you're on the travel team. And so we're really limiting the kind of after school or community physical programming, physical activity programming that kids can have. When we have such a beautiful state, it seems as if we would be utilizing what we have, our assets better than we do.
That's exactly where I'd like to share just a couple things. It's just about our resources in the state that we have and just the attitude we have toward them. I'm not sure, am I able to share screen while you have the other one up?
I didn't realize I still had the other one.
Well,
up.
I can try to share here. Oh, can you see me there? So
Yeah.
when we look at our resources in West Virginia, of course, I mentioned Fayette County, the outdoor recreation capital of the world. There's probably more kayakers and paddlers just within that area than the whole rest of the state combined. But, if you look here, this picture here, you'll never guess, this is the Connelly River in Charleston, just not even a mile from the capital. And for so many years, the Connelly River has been leveraged as an industrial resource to transport, transport other resources, coal or whatever it may be. And we've completely neglected it as a recreational outlet. And the river just runs right through our state. People may complain that it's unhealthy to be on that river. Well, we're not even 40 miles removed from world-class whitewater. The Gauley and New Rivers, they flow right into this. So we just think, there's an upstream approach in prevention, which is, of course, if you want to figure out why everyone's floating downstream in trouble, you can keep pulling them out in Charleston, or you could go upstream and figure out why they keep falling into this in the first place. That's another plug for prevention, so we can continue to rescue people, or we can equip them, put a life jacket on them, teach them how to swim, teach them how to paddle. And that's just one thing. So I just did want to share, these resources are right here all around us. So the Putnam County Paddle Cooperative is just, we've started an after-school paddling group where kids can pay their grade to paddle. So, kids in second grade, they'll bring $2 and pay to paddle. So they have some small investment, but it's minute compared to the typical cost for something like this. And the other hashtag we use is called Paddle for Prevention. And I told a pastor that one time and he laughed. He said, "So you're going to spank kids to keep them from doing drugs?" And I said, "No, sir, that's the archaic way of thinking. The scare tactics are no longer relevant." So we equip them with a new skill or resiliency like paddling. So I love stand-up paddleboarding. That's what my passion is. And then here at Putnam Wellness Coalition, I'm highlighting our Facebook pages because this is one of the key ways we engage our community in the work that we're doing, especially amidst COVID. So we've created a couple groups. Here's one we've created around healthy alternatives, and it's called Mind Your Health for a Better You. So this, again, is just one of the several groups here. Of course, we shared the resource that we're on now, the live stream. Did you know there's a haunted half marathon coming up this weekend, and it happens to be on Meeks Mountain Trails. And as you see, we'll just share healthy, fun resources for the youth. Last week there was a costume 5K that we helped host, and of course we put kids in the imagery, so you see kids playing there. It's a great thing, but a lot of these things wouldn't be possible without people that are helping lead the way. So one last plug on resources. We're developing 26-mile trail system right here in Hurricane, West Virginia. It's called Meeks Mountain Trails. But what you see here is the trail building team. We're on mile 17 or 18 of this trail system, and there's young people getting out, and we're literally creating positive pathways for young people. And it couldn't be more valuable. So I get a little emotional on this topic. I do want to pump up my friend Amy that's on here because she started a group called Putnam County Fun for Youth. I think that's on Meeks Mountain Trail as well. Her family there enjoying it, but Amy has started this group, and I'm not sure, Amy, if you want to speak to this or another topic, but I just wanted to set you up for that. She started this Facebook group and shares a ton of great resources. But I'll stop share for a moment and give it over to Amy if you'd like to share.
Sure. So a couple of new initiatives that we're trying here with Putnam Wellness Coalition in our county is like the discussion had been, you know, how do we link people? How do we let them know about programming? So one of the things that we're trying right now is we've started this Putnam County Fun for Youth Facebook site. And it has been phenomenal how quickly it's catching on. Like, I am so thrilled. The goal was to connect families with things to do. You know, a lot of us in the coalition were parents. We're looking for things to do. I was looking for things to do with my child over the summer. You can go so many places in Putnam County. I mean, I was making a list of all the shout outs I wanted to do to our community partners because there are so many. I mean, we have Valley Park is constantly hosting programming. The Convention and Visitors Bureau has a monthly calendar of all the family-friendly activities taking place in Putnam County that they know about. Our library system is constantly hosting things in each of our branches of our library. Evan has mentioned Meeks Mountain Trail Alliance, and they are so focused, and Hurricane Trail Racing, they partner together, so focused on mentoring youth. They want youth out building the trails. And they do. The youth come out and they build the trails. They play with the kids while they're building. You know, if they find bugs, they show them to the kids. They make it fun. And, you know, some of the kids, especially some like junior and high school youth, are really, really involved in trail building. Also, they're hosting all of these running activities, and they always include a family fun run for the youth. A lot of the youth, it's amazing, will go and absolutely kill the adults in these runs, in the competitive ones. But there's also the fun youth runs and youth activities to try to get the youth involved. You know, the mayors in our county are amazing. The mayor of Hurricane and the city of Hurricane are just phenomenal at listing all the activities. There were probably, I don't know, 15, 20 trunk or treats in our county in the past few weeks. It has been crazy, the amount of events. Now, of course, we're talking about just events. We're talking about things that parents who are engaged are going to take their youth to. So one of the other things that we're trying to do within this group is link kids with positive extracurriculars. You know, like it was mentioned before, not every kid is going to be the sporty kid that wants to join the school team. So we're trying to find as many interesting, different kinds of things that Putnam County has to offer and highlight those. Like last night, we highlighted there's a sewing group that teaches kids how to sew things. There's disc golfing. There's an ultimate Frisbee team that's just started ages 16 and up. There are, let's see, what are some of the other interesting things going on in Putnam County? I mean, there are there are several horse stables that offer horseback riding. We have scouts, I mean, you name it. So what we're trying to do is we're trying to connect with as many of those as possible, put them all on this one group so that we can help connect people so they don't have to go to 15 different websites to find these things. And what we had hoped would happen, and what seems to be happening, is that these community partners within the community are now posting. The group is running itself. You know, you've got the ball teams are now saying, oh, you know, we're recruiting for our ball team. Here's where you go to sign up. Yes, you know, because essentially, you know, we can help connect people with those mentors that are already within our community, because we have so many amazing community champions. You know, and again, the idea is to get it out, get the word out. You know, how do we get it out to the kids and the youth whose parents are not as engaged? You know, and we're working on that through some of the things that we've already mentioned. Another thing that we're working on is doing an actual healthy alternatives guide. And that's going to include all of these things we just discussed. What hiking trails are in Putnam? Where do you sign up for Little League? How do you contact someone if you want to play volleyball? Who do you contact if you just want to go do messy art with arty kids or theater? So we've put that together, and that's just getting ready to be released. So we have a phenomenal member of our team who is very techie, and she's very marketing skilled. So she's going to connect this to QR codes so that we can share those QR codes with our community partners in the community. People can just scan that and it'll immediately take them to that healthy activities list in Putnam County. So those are just a few things. I know I've rambled, I'm sorry. I'm like Evan, I get very passionate about this. It's exciting. You know, the more we can connect youth with mentors in our community, it's just amazing. Putnam County has just the past few years just come so far.
So one of the reasons that I thought it was important to have you on the panel today is because you know, your approach of we're going to where they are rather than expecting folks to come to us, because that seems to be something we find across the board when it comes to almost every issue like food insecurity. We have this tendency to create a list of phone numbers or resource guides because that's how we've always done it. And now we've got this increased number of, you know, well-meaning but inattentive parents, and we have to change the way we do a lot of the marketing or ways we engage parents and families. And you know what you do on Facebook to share that information, you know, I see you on the feed all the time, and I think, you know, wow, they've got so much going on in Putnam County, and it just makes me wonder, is this what's happening in other counties? Because you don't really see all of that information centralized in one place. So just doing that, I think, makes a world of difference in families knowing where to go to find out what's going on in their communities. We're closing, we've got about 7 minutes, and there are two more questions I want to get to. One about academics, and I think Susan may have some ideas on that. And then I want to give all of you an opportunity to talk about how to get people engaged in the work that you're doing, because, you know, I think that's so important too, is getting more community members involved in the work. So let's talk about academics. How can after school and community programming help with academic achievement? And are we utilizing it to help students catch up after last year and COVID-19? Susan, do you have any thoughts on that?
Sure. Well, first of all, whenever we're thinking about traditional after-school programs, we know that those programs, you know, if kids don't go to school, they don't get to go to after school, right? So first of all, they're, you know, helping to decrease school absences, helping to increase graduation rates, grade promotion, all of those things. But we know, I mean, there's lots of research that I can share with people if anybody wants to reach out later around how after school and summer programs close the achievement gap, address student mental health, ensure safety, nutrition, physical activity. I think just a lot of the different pieces that we've been talking about here today. But we've really seen our programs, you know, step up and just be really innovative during COVID, because all of a sudden they were in this new space, right? Because kids that typically would be in school during, let's think about, you know, whenever schools were closed, were trying to engage or do schoolwork during the typical day, and they were suddenly at their after school program, but they were there all day long. And I think now that even schools have opened back up, that there are just so many different aspects to think about of how after school programs support academics in terms of thinking about some of those challenges that we talked about earlier with space. After school programs have space, after school programs have staff, after school programs have prevention resources, and just so many different things that they're doing to really support academic achievement. So we've seen some really unique things. I don't want to take up too much time talking about that, but I do think that we, and I'm sure, you know, with a variety of our activities for kids, they've just become very innovative in how to support youth and families during this time with their schoolwork.
Thank you, Susan. And I know that we've done a little work towards a resource guide for staff to help address some of those, or refer staff to resources around the state to help, you know, if they suspect substance use disorder or misuse disorder in a family, what they can do to help educate themselves, but refer families to needed services. And that's the sort of thing that, you know, helps shrink the holes in our safety net to ensure that, you know, families get to point A to point B, again, prevention to get what they need to keep the family thriving.
Yeah, absolutely. Thank you for highlighting that. I'll just make a quick plug if that's okay, Kelly. I know that Lauren Farmer is on with us today from our office. Also, Lauren, if you want to post up the meeting we're going to have on November 8th, but we are releasing a replication project that we did with Tennessee that they have already done around After School Hills, Tennessee. It's going to be After School Hills, West Virginia. That is really, it's not about creating additional new resources, but really taking all those resources again and putting them into one place. If you're, you know, needing supports with drug abuse or prevention or social emotional learning or whatever that may be. And we're going to be releasing that on November the 8th. So we would love to have people join us for that release meeting.
Well, you can count me in for that. And thanks, Lauren, for sharing that information. And with the time we have left, I want to open the floor to everyone. If you're working on a program or project and you're looking for some support, what can folks do to help?
Well, we are always looking for, we do consistent programs throughout the year for just kids and adults to get them active. So we're always looking for volunteers to help out, to lead those programs. We provide training as well as with our Kids Run Club program. So if anybody's interested in learning more about what we do or how you can get involved, you can search us up online for our website, activeswv.org, or Facebook is a great way to kind of get in touch. And we post there constantly on just Active SWV, Active Southern West Virginia on Facebook. So lots of ways to get involved there.
And can you remind us what counties you serve?
Yeah, so we're Raleigh, Summers, Nicholas, Fayette, Connaught, and Boone officially, but then also with COVID, we've been able to expand virtually. So we've kind of been expanding statewide slowly. So really all counties, but those most consistently.
Wonderful, thank you.
I will continue to follow, you know, India and the team at Active Southern West Virginia, because they're just such a great guide, such a great model. And in a collaborative culture, as opposed to a hero culture, it's okay to do that. You know, it's okay to try to replicate that in our community. So thank you guys for knowing the way and showing the way. I shared some of our resources, of course, Putnam Wellness Coalition. Please like us and join us on Facebook. That's where we have the most ongoing engagement, just far as for our online community. But I did also want to share another group that has really helped us out. They helped us start the Paddle Cooperative in Putnam County. It's a group called Try This West Virginia, and they also offer mini grants to communities to start, create your own movement centered on healthy food and physical activity. So they'll award up to $3,000 mini grants. So we've gotten equipment and resources for our paddling club. They've helped start community gardens and stuff like that as well, which is also an incredible after school activity for young people to decompress and get their hands in the earth. So Try This West Virginia is another great group. They have a great Facebook group with over 6,000 people and a lot of great ideas constantly flowing. And they actually have a networking event tomorrow. So jump on their Facebook group. You can go to their networking event. I think it's around 3 o'clock to find even more friends and resources centered around how we can serve our state best.
Thank you, Evan.
Mm-hmm.
Maddie, any more questions online?
No questions to report, Kelly.
Thank you so much, Maddie. And we are officially out of time. And we had so many great questions that we didn't get to, so maybe we'll do this again in a few months. Many thanks to the panelists. What a wonderful conversation. And so I really appreciate your time and expertise that you shared with us today. We'll be sharing links to programs and services mentioned today in the chat. And we're going to post this video on YouTube tomorrow on our YouTube channel. So if you know anyone who works in this space or is perhaps looking to get their kids an after school or community programming, please share the link with them on YouTube. So again, thanks for watching. Thanks to you panelists, and hope you all have a great day. Bye-bye.